All right, we're going to try this again. This is going to be our medication review. Since I've been having issues, I don't know if it's how long it is, so we're going to do a condensed version. I may do a couple of them just so get it posted. All right, so 35, 36, and 37, 3 key chapters on medications. Some things that you need to be aware of is your schedules. Know the different schedules. Which is a Schedule 5 medication? What are your Schedule 3 medications? Schedule 2, 4, and 1. All right, the common ones that's in that box. Also, what is diverting drugs? What does that definition mean from your key terms? Another thing we need to know is allergies. When do you ask for a patient about allergies, and what do we do if someone says they have an allergy? Either it's a true allergy or it's a, they say it's an allergy. We document it as an allergy and write in with our documentation what they actually said. A rash, upset stomach, whatever it is. What's one of our main priorities when we are doing medications is educating, right? We want to make sure our patients understand why they are taking this medication. All right. How many safety checks are there? We have 3 safety checks. You need to know those 3 safety checks. All right. You have your doctor's orders. What are all the required required components that needs to be listed on your doctor's orders to make it a valid order? All right. Intradermal, 10 to 15 degrees, bevel up, and it creates your bleb. Okay, we did that in Skills Day. Allergies and tuberculosis, or TB. All right. Subcutaneous, insulin and heparin. All right. 2 nurse verification because it's a high alert medication. 2 inches from the belly button. 45-degree angle, bevel up. Need to know the terms lipohypertrophy and lipoatrophy. Okay. Heparin, back to insulin. Need to make sure you have a blood sugar prior to giving insulin, and you need to follow the orders for the insulin based on what it says. Okay, heparin, again, 2 nurse verification. High alert med. Which labs do you need to check before you give heparin? Need to know those labs. What also would you need to check for? If we already say heparin is a blood thinner, would you give it if your patient has bleeding gums? Okay. Again, sub-Q, 45-degree angle, again, 2 inches from the belly, subcutaneous areas. You need to know your landmarks. IM, 90 degrees, okay, deltoid, 0.5 to 1 ml solution. All right. Anything more than that, it would be in the ventral gluteal because that is the safest because it's not near the sciatic. If you have a viscerous, which is thick medication, you're going to use a large bore gauge, okay, because you want it thick. Okay, so you got to be familiar with those. Insulin, remember, it is in units. Your insulin needle is in units. Okay, IM is going to be dependent on the size of the patient, the location of the injection, and the type of injection, how much. Okay, those are going to be 3 common factors for that. Okay. What is stat? If doctor orders a stat medication, how much time do you need to get it? If it's a now medication, how much time do you need to have it on board for the patient? All right. If somebody doesn't want to take their medication, do we just document it, or should we try to encourage or educate them on the purpose of taking the medication? If we make a med error, you go fill out your incident report, correct? Notify the physician, check vitals, and see what happens. Make sure there's no adverse reactions, and go from there. If your patient wanted Tylenol and there's no Tylenol ordered for a headache, can you just go give Tylenol, or do you need to ensure that you have a doctor's order? Yes, you do need to ensure you cannot just give a medication, even though it is some general over-the-counter stuff that you can find. As a nurse, you have to have a doctor's order to give anything. What are some of the medication errors? Why do some med errors occur? Some of them are prescribing, not reading the order, so you give it the wrong route, not giving the medication, giving the wrong medication, during admission or discharge. All right. Make sure you know your rights to medication, all rights. Crushing meds. Can we crush a extended release, controlled release medication? Why not? What's the trade name of a medication? The generic name. Okay, be familiar with those. All right, I am going to upload this. Hopefully we go okay, see how it goes. And then I'll do another one for our PEG tube and some other information on the medications.